Yesterday, I had the opportunity to adjust two little babies. One was coming in for their first visit, and the mom brought her in because she was having colicky and a little constipated, a little gassy, and so we adjusted her. Now, she also noticed that her little baby couldn't turn her head to the left as well. And so that is usually what we find with these babies, is that during birth, they get a little bit of irritation in that upper neck, the very top vertebrae, as they're being born and they're being pulled out. That will irritate that area, which then leads to some inflammation, which then irritates what's called the vagus nerve. It's a cranial nerve, but that vagus nerve, it travels around and it will end up into the stomach and innervate and control what happens in the digestive tract, and especially the stomach. And so we have these babies that have this gassy and distended and just aren't feeling well. And what's happening is they're getting irritation way high in the neck up here. And so by treating up here, we can help their colicky symptoms. And so I had one baby that came in for the first time for that, and then another one that came in later in the afternoon. That was their second visit, and they're doing okay. They're still having some constipation that we're trying to work with, but normally with babies, if we treat them once, maybe twice, sometimes only 3 times, and they are doing so much better with their colicky, with their gassiness, with their constipation. We also treat babies for maybe a little bit of rotation issue, like they're not turning their head or they're having a hard time feeding on one side when they're being nursed, and it's because their neck kind of bothers them, and so they hate turning that way. So we adjust them really lightly. Normally I just do it with my fingers, or I might use a little tool called the activator to adjust them, but super gentle, super easy. And the nice thing about babies is they're really quick to get better. So if you know of any mother that's dealing with a colicky baby, have them refer them in. We'd be happy to treat them.